Okay, so now I want to talk about treatment. So if you figured it out with the functional analysis, now I can develop a treatment protocol, and basically you need a replacement behavior. So one of the most common things they do, because these kids are not communicative, they don't talk, is they'll often just make a laminated card that the kid can hand you or show you to ask for what they want. So, for example, one session I watched was this girl she was probably about 13, really big girl. I mean, I don't know, close to 200 pounds probably. And her behavior was flopping. Meaning, and she used it to get out of requests or demands. So if you asked her to do something, she would just like melt on the floor in a big heap. And it's like, well, okay, what are you going to do with that, right? So I was watching like one of her initial treatment things. So they had her sitting in a chair, and this took 2 therapists. They had a harness around her, and with like little handles, and then they were trying to get her to do like some academic work. So they go, okay, all right, Shelly, we're going to do this worksheet. I want you to do this first problem here. She's 13. She didn't communicate, but she wasn't an idiot. I mean, she could do schoolwork. She just didn't want to. And so they go, okay, let's do this first problem. Do that math problem for me. And she'd start to slide, and they'd have to like pull her up.
Oh, gosh.
And it was a matter of like, okay, we're going to block this behavior. You're not allowed to slide. But we want you to do the other. So they had a laminated card that said, like, give me a break, which is hilarious. And it was, like, had a little lanyard. And to teach it to her, they were going to do what's called a full physical prompt. So they're holding her in her chair, so she wants flop. Take her hand and say, show me your card, Shelly, show me your card. Take her hand to pick up the card, hold it up, and go, okay, you want a break? We'll give you a break. We'll do this later. And so they do that a few times, and like I said, she can learn that pretty easily. She wasn't dumb, she just didn't talk. And she did have, abnormal behavior and things. And so she, after a few trials, they don't have to pick up her hand, she'll do it. And at first she might just grab it, and they say, oh good, you're showing our card, put it right out here, good for you, okay, you get a break. Okay, so even after a couple of training sessions, they'll do all right, let's do a math problem. Let's do that first problem. Can you do it? And she just share her card. They go, okay, we'll give you a break. Now at this point, do they go, all right, Mom and Dad, we're good.
No.
You're welcome. See ya. I mean, is this good treatment? No. Okay. We got to get her to actually do something, right? So what now might we require of her?
Complete a problem.
You got to complete a problem. Okay, we'll give you a break after you finish this problem. And maybe at first it just takes 1, and then we give you a break. And then we're going to require 3 problems. Then you got to do the first whole part of the sheet. Now what do we call that process?
Change.
Shaping.
Let's go with shaping. I don't know, chaining, shaping, same thing. Because I am losing. The initial thing was 1 problem is good enough. That's not good enough anymore. So definitely we'll call it shaping. Because now you have to complete a whole worksheet before you get a break. All right. So that's what they do. Another example would be there was a kid who was he was the one that kicked the holes in the wall, and he would break stuff. He would bang his head, and usually it was his reinforcer was attention. So it was a real problem if Mom was trying to get dinner ready or trying to do some chores around the house, that he would just act up. And so his little card seems so sad, but his little card said, "Play with me."
Aww.
I know, isn't that like, oh. I don't think he would like that, but it just seems so like he would show his card. So to teach him this, at first, they would run these things where Mom wouldn't be paying attention, and then he would hold up his little card, and they do use the parents sometimes in these training things, and of course eventually they always use the parents. So he'd hold up his card, and she'd give him immediate attention for a bit, and he would learn to do that. But then now you have to shape up where he has to handle a delay. Mm-hmm. Okay, I'll play with you in just a minute. And so like maybe 30 seconds later, she's playing with him. Okay, now I have to do my work. And if he shows the card, all right, I'll be right with you. 30 seconds perhaps. Mm-hmm. Now I'm there. And then you gradually shape up where they can tolerate. And what was amazing, I saw a before and after video of this kid. And at first he was just screaming, and it was just chaos, and Mom couldn't do anything. And then the after video, she's starting to make dinner, and he comes up with this little card, and she goes, okay, once I'm done making dinner, I'll play with you. Why don't you just go and color right now? And the kid quietly goes over and starts coloring. You know? It's just like, whose kid is that? You know, like he was just this perfect model child, you know. It's like, wow, that's amazing. So that's the kind of treatments that